When blood supply to a part of the brain is interrupted, the brain tissue gets damaged and begins to die. This is known as an ischemic stroke. A common cause for an ischemic stroke is when a blood clot, called a thrombus, travels from an atherosclerotic plaque in the carotid artery in the neck or from the heart and blocks the blood vessel in the brain in a process known as clot embolization. Clots frequently lodge themselves in the primary blood vessel branching off the carotid artery in the brain, the middle cerebral artery, or MCA. The MCA bifurcates to supply different parts of the brain with blood. At the M1 bifurcation, the diameter of the branching vessels is much smaller than that of the M1 segment. As such, this is a common place where large emboli get stuck. For years, there had been no treatment options for patients suffering from stroke. That changed with the development of endovascular thrombectomy, or EVT. EVT is a minimally invasive procedure where access to the blood vessels is obtained at the groin or wrist. With the help of contrast ion imaging, the microcatheter and microguide wire are moved through the arterial system in the body until they reach the embolus in the brain. Next, the microguide wire is pushed through the clot, followed by the microcatheter that is fed over the wire until it too has been pushed through the clot. The wire is then removed and replaced with a self-expandable stent called a stent retriever. The stent remains in an unexpanded state until the microguide wire is pulled back, thereby unsheathing the stent retriever, which then expands in the vessel distal to the embolus and within the embolus itself. The embolus is thus squeezed between the stent retriever and the vessel wall, or entangled in the struts of the stent retriever, or both. The antegrade blood flow in the internal carotid artery is then temporarily halted by inflating the balloon of a so-called balloon guide catheter, a large bore catheter with a balloon mounted around its outer distal perimeter, thus occluding the blood vessel but leaving its own bore open. The stent retriever is then retrieved while still expanded and while aspiration is being performed via the balloon guide catheter, thus effectively reversing the flow in the blood vessel. Since the embolus is trapped or entangled in the stent, it is dragged along with the stent retriever, aided by the reverse flow created by the aspiration, into the large bore balloon guide catheter, successfully removing it from the artery and allowing the resumption of blood flow. The quick workflow of stent retriever thrombectomy allows the rapid recanalization of blocked brain arteries, thus making it the gold standard treatment strategy for ischemic stroke caused by blockages in accessible arterial segments of the brain.